Good evening, everybody. This is Dr. Apurv Mehra, and I have an honor of all the stars of the medical fields on one screen. You know, if you look at the background that Gogavai is shining with, it just shows the world is here to stay. I welcome you, Sin, and
So I think,
the
sir,
role here in the same.
your network is
Would
breaking.
like
Anyway, so maybe we can take over. So, good evening, everyone. I think Apurv sir's network is a bit problematic. So we are having this session to talk about medicine as a branch in PG and the pros and cons of medicine. And apart from Dilip sir, none of us is a medicine specialist, but definitely we have been in this field for many years, many decades probably, and we do have something to share. So first of all, I would like to welcome everyone. Vivek Jain sir, good evening.
Hello,
Goga
sir.
sir, good evening. Sparsh sir, good evening. Zainab ma'am, good evening. And of course, Dilip sir, you have to do all the talking tonight. A very warm welcome to you as well. So,
Because the time you are the guys who ask like very good questions are more than the students. Maybe of course on the behalf of the students, but I've seen in the last time itself, you have been asking very good questions.
thank you, sir. I want to be one of your good students. That is the final dream. All right. So, Dilip sir, medicine, I think, is one of the evergreen branches. And I think the majority of students aspire to become medicine specialists. I mean, now students aspire to become cardiologists, neurologists, and other super specialties, want to go into other super specialties. But medicine is the go-to branch for most of the students. So, a lot of students have many queries. So, first of all, we can address some of those queries and then we can go on to the specific questions. So, sir, my first question to you would be that what is it that a student should think before getting into this branch? I mean, what are the absolute must before getting into medicine residency?
Absolute must in the sense most of them will be carried away by
Mm.
what others are saying. So they should
Mhm.
not be carried away. First of all, they should like the field.
Mhm.
So they should be interested. That's what I say is important in any field.
Mm.
Medicine may look very attractive from outside,
Mm.
like what they're seeing from outside in the sense
Mm.
the diagnostic abilities, maybe some Instagram channels where they post cases about medicine,
Mm. Mm.
but it's not always like that.
Mm.
People make it look or appear pretty, but inside there are a lot of cons that we have to deal with.
Mm.
And especially in the first 1 to 2 years, there's going to be a lot of hardships. And even during practicing, so it's not easy nowadays. Like
Mm.
maybe when we have started practicing, even we said like it's not that easy, it was quite difficult, but nowadays it's becoming even more difficult because of the competition and because of not much job opportunities unless until you do super specialization. Even if you do super specialization, you are bound to wait for some time.
Mhm.
Maybe I can tell plenty of examples like in my hospital itself, there have been a couple of super specialists who have been trying to get in, but they couldn't for the last 2 years.
Mhm.
And basically they are cardiologists and nephrologists.
Okay. So, sir, this is a very interesting topic that raised the topic of saturation. In fact, you are active on Twitter nowadays, and you must have seen that there was a Twitter war going on. That some people were saying that there is a saturation in medical sciences. Others were saying that we are very far away from it. And I think, I mean, after reading views from both sides, I think that there is some north-south divide also. In South India, we have got many more doctors with many more medical colleges opening up and probably saturation is starting to set in. So, but is that a pan-India phenomenon or is it something more localized?
I would say it's more localized to South, sir, because I don't know for what reason they're coming with more and more colleges and more seats. I'm not very sure about it, but that's a governmental policy. We'll not be able to comment anything on that. But yes, it's true. There have been so much of saturation happening. And the people I've said who have not been able to get into, I mean, my hospital is not a very big hospital. It's a reasonably simple hospital, but they've not been able to get through almost for a couple of years. And these people have done their super specialization SGPJ Lucknow.
Okay.
And it's not a very small institution or a private institution. So if these people are not able to get in that easily.
So I want to ask Goga sir and Vivek sir. Sir, I mean, you guys are so seniors and you have so many friends in different specialties. Are we seeing a similar thing in the northern part of the country as well? I mean, do you think that there's the situation setting in based on your interaction with your colleagues and juniors?
Sir, I don't think so. I think maybe tier one, tier two, tier three cities, sometimes we try to categorize, but the population, the way it is
Hmm.
exploding,
Hmm.
we are still having one doctor per 1,000 population in the country as of now.
Hmm.
So I don't think there is a saturation setting in as of now. Yes, when we go to a corporate hospital, it appears already they have someone in place.
Hmm.
But look at these so many chains of hospitals, nursing homes which are coming up. I
Hmm.
don't see any saturation as of now. To be very frank, I have not seen a single MD medicine yet sitting idle.
Right. Right. Goga sir?
Little bit agree with Dr. Vivek, but not totally.
Hmm.
Because many of the students I talk to who are MD medicine, they have plans to settle into big corporate hospitals.
Hmm.
Usually they are not able to settle easily.
Hmm. Hmm. Hmm.
Some lag period. Yes, definitely they are not sitting idle. They can
Hmm.
get jobs here and there at some
Hmm.
places.
Hmm.
But getting a job of your choice,
Hmm.
nowadays it is taking a little more time.
All right, but I think we started this conversation on a little pessimistic note. Why are we talking about saturation in the beginning? Let's talk about good things first. I mean, as I said, I believe medicine will always remain an evergreen branch. People would always get fascinated by the medicine. I mean, that is the crux of what being a doctor is. So let's talk about good things, Dilip first. Dilip sir first.
Yes, sir. Yes.
Tell us good things about getting into medicine residency.
Yeah, good thing about getting into this. I mean, first of all, I would say like people who like reading or those who love reading, like definitely will love this. And
That's not a good thing. That's again.
Perhaps
I,
one of the reasons why we are out of it now.
I'm a very different person, sir. I mean, basically, maybe before my son was born,
Hmm.
like the only thing that gives me pleasure is reading. I mean, obviously, for some reason, I don't know. I'm a very weird person in that kind. So I felt always like that. So I cannot be idle even for a single day without reading. So even when we went to New Zealand, like I always used to read something. My wife also used to say, like, even in the flight, you're reading some articles. Like, why you want to do that? It's a oncology article anyway. I'm not going to treat that patient. Why you want to do that? But anyway, so there are some guys like me. So definitely they'll be there, and this field is definitely for them. So those who want to keep reading.
So, sir, definitely people who are like they who really love medicine. For them, medicine is of course a good branch. But students nowadays are more practical. They say that okay, I like medicine, but I want a good work-life balance as well. I want to start earning well and as soon as possible.
This,
So
this,
what about those?
this is a good field. This is a good field where you can get a good work-life balance and you can dictate norms in medicine. It's not like surgical fields where you have to. I mean, sometimes like I've seen like obs-gynae people, so they have to come anyways, even at 2 o'clock or 4 o'clock. So they are bound to come. And even if as a surgeon, if you have done a surgery and if a patient gets complicated, you get some post-op complications. Anyways, the onus is on you. So you have to be here and you have to pacify the patient. So compared to all those things, I would say like uh, medicine is okay in that regards. Maybe you can set your norms yourself. If there is something, I mean, if you don't want to admit, you need not admit.
Mm.
That's it. And there are some people who are admitting under a different person also.
Mm.
For example, my HOD is a neurologist, and most of the time, like she's working here and she doesn't admit in her name because she doesn't want
But I
to.
think your HOD might get into trouble for this. So
No, sir, it's not like that. In the sense, like I mean, I know her very well because I'm a student and she believes in me. So, I mean, there are people at one point of time, what they think is like, I don't want to like take these kind of chances. At any point, you can do and you can admit under somebody else's and you can take care of the patients. They can take care and you can just give your inputs. So you can always dictate norms, provided like you have to be in that place.
and sir, in today's time, is there a space for a MD medicine who does not want to go for super specialization?
I would say very little, sir. So even though I'm an MD medicine, still, I don't want to do DM because of the lot of commitments I got into. So I couldn't do DM, but still, for my sake and for patient's sake, I've done a lot of fellowships.
Mm.
Like even now I'm practicing as MD medicine, but my core field is rheumatology.
Okay.
And I see a lot of rheumat patients and I'm doing it silently because if I say I'm a rheumatologist, then I might lose the other set of patients as well. So I'm not telling it openly.
Mm.
But my core field is rheumatology because I have a specialty certificate examination done in that. Before that, I have done acute medicine,
Mm-hmm.
MSc, I have done infectious diseases. So I've been practicing actively on infectious diseases and rheumatology for the last like 7 years. But I would still say, yes, specialization is important, sir. You cannot just like that do MD medicine and just expect the patients to come and flow. So it's very difficult. Maybe if you're just practicing as a GP elsewhere, maybe in a tier 2 or maybe in a tier 3 place, so then that might work. But in a city, if you're just an MD, probably I don't think that will work maybe after 5 years or 6 years.
Okay.
Praveen,
Isn't that going to be an example of a very tunneling procedure, sir? I mean, vis-a-vis, let's say, somebody who's a graduate, a good MBBS graduate, vis-a-vis somebody who specializes in medicine, vis-a-vis somebody who does a super specialization. Are you not kind of, funneling your down too much? I mean, because what I find is that on a good note, a lot of our previous students who have even finished super specialization would go in for some kind of an international fellowship. And so a very practical question which comes is that for how long do you wish to study? I mean, what's that age and what is that they are having in their mind?
What you said is right, sir. And again, there is a very thin line in that. We're not able to differentiate right now because we couldn't understand the dynamics of what's happening, honestly, in the society. So we don't have the accurate data. So how many people are doing the specialization? How many people were not able to get in? How many MDs are not able to get into the place that they wanted to? So I'm talking about the place you wanted to be. So for example, if you do an MD internal medicine, still you'll be definitely getting a place in a government college or maybe in a private college.
Agreed.
As an SR, or maybe even you can get promoted as an assistant professor. In that regards, you still have a lot of lacunae. So if you, I mean, a lot of my friends, I mean, I keep getting messages in the Telegram as well as in the Instagram groups or maybe in the WhatsApp groups. They keep saying that we need like 4 faculties in medicine, 3 faculties in medicine. There is a lacunae, this college, that college. So as the more you move away from the cities, the more you move away from the tier 3 places, tier 1 places, you have a lot of opportunities, especially in terms of institutions, the private colleges and the government colleges. But I'm not very sure about it. How many of them really want to settle in that area for a long time? That
Dilip
is
sir,
one question.
I am working in a corporate sector in Delhi, and what I realize is that an MD medicine is a core person for get any patient to the OT. Without the physician consultation, you cannot go ahead. Also, what I realize is whosoever you can see on the screen here, an MD medicine takes care of everything, all the branches he needs to know. He can discuss in length with Goga Bhai about all the medicines. He can discuss with Vivek sir for the stats and different epidemiologies. And he can take a lot of patients of Dr. Praveen sir, I'm very sure, with simple 2 tablets.
Yeah, they write message to everyone.
And then interact with Zainab ma'am, and they do have an overlap of a lot of things. And unfortunately, the least overlap was with orthopedics, and you specialize in rheumatology. So that also you have taken away. That was the only thing. I also feel that medicine is one complete branch. What you think of as a doctor when you were a child, this is actually the branch which you thought of, a physician in the society.
Correct.
We became doctors thinking like that we will one day become like Dr. Dilip sir. You might say that you're practicing in a hospital, but then we all know that you have a great following as a clinician, as you as a teacher, which is something very precious. I never left practicing for teaching, and so you did not. And it's very, very important that we stay in touch with both the things. In fact, our patients educate more. Coming to Dr. Sparsh sir's point, it is absolutely correct. If you go to specialization, you keep on going to super specialization, more fellowships, you funnel down. For example, a cardiologist might not look at the patient as in toto.
Exactly.
He will look at the entire thing as in total. And this is what is the most precious thing for the society. A physician is the most loved asset in the society.
Absolutely true, sir. I can tell even maybe half an hour ago, if you had this meeting, I can even show a case example. There was a patient who was admitted in Gangaram because that was one of my students who have been doing cardiothoracic surgery course in Gangaram. I think it's a DNB 6-year course, if I'm not wrong. And his father-in-law had a issue with regards to, he got an MI, I think, and he was placed with 3 stents, and he's having a progressive renal failure. And he has been seeing a nephrologist, he has been seeing a cardiologist, but they came all the way down here and they want to have a consultation. Like, just if everything goes wrong, so you want to adjust the medicines and all those. So yes, we see these kind of things every now and then. So what you said is absolutely true. So everywhere there should be a physician to see things as a whole, 100% true. So I'm not saying no, but the mentality has changed, sir. And the sense like corporate hospitals, how many of them take the fresh MDs now?
Agreed.
So that is the big problem that MDs are facing right now. So for example, if I am there and there are 3 consultants already well settled in my hospital and they don't want anyone else from now on. So even how much ever they try, someone else is going to try unless and there is a need here. Nobody is going to take them. So that is the only challenge that they'll be facing. And that too in a corporate aspect, definitely you will be knowing much better than me. I still remember I attended one of your demo classes before, sir, when I was a PG student. And that time also, you said the exact same thing. That no matter what you should, I mean, you're here to do something to the society. So I still remember your words. It's been very motivating from those days. And that's something I took for the last like 13 years, if you ask me. I mean, you might not remember me, but I remember what you said.
Is he talking to me?
Yeah, he's talking to you, sir. He's just showing the fact that you happen to be pretty senior amongst all of us.
Don't do that to me. Okay.
No, sir,
So
13
But
years.
I
अपूर्व
I
सर
mean,
ये
sir,
कहाँ
sir,
स्ट्रीम हो रहा है? ये बच्चे के क्वेश्चंस कैसे मिलेंगे हमें? Where are we streaming this?
we are streaming on e-conceptual. So we come.
YouTube channel.
But my humble request to you would be, Dilip sir, since a lot of people per se are fans. I mean, you have got fans amongst your peers, your faculties, of course. We too are big fans of your teaching. My point is, I mean, something coming from your mouth is going to be acting as a vital tool for them regarding the importance of what they should acquire as a skill during their residency. You see, what we are facing as of now is that people who are graduating, they have a tendency to, let us say, prepare for an exam, ignoring a lot of the teaching which happens in the hospitals. The same might be true in case of people who are pursuing their post graduation. In their genuine quest for going into a super specialization, they may not be doing their residency with the kind of I would say sincerity or the acquisition of skill sets as may be desired. So this is where your role is going to be very critical. One, if you are acquiring those skill sets properly, it will ensure that all of them are going to be doing at least a basic, lifestyle, which is going to be far better. They will be able to look at the patients in, I would say, a complete manner. And second, yes, your role would come in over there because they would love to study from a galaxy of teachers who are having a requisite experience. Perhaps that's where they are going to be following you, your teachings for their post graduation as well.
Absolutely true, sir. And I mean, they need to attend the wards. And what we are seeing with the DNP graduates right now, I don't know about MD, what's happening. It's the same. But if you see the DNP graduates themselves, like they're not coming regularly. Very few people come regularly,
Right.
attend the clinics. So they are I mean, they're not even reading. I don't know. I mean, they're just stuck with some of the YouTube sessions or whatever it is, and they're not coming to the clinics. And as a result of that, this is one place where you can learn about everything.
Right.
So during their postings, during their rotations, they tend to see every single type of case in medicine. So that's a big plus actually. And anyone, whatever they ask, you will be able to answer something. So no other field gives you that flexibility. So medicine gives you that flexibility. So you will be able to answer everything. So whatever the question asks, even my patients have asked about like how to keep their skin better. So a lot of cosmetology related questions they will ask. Even I have to learn about that as well. So
Sir,
because
how please let us know as well.
yes, sir. We have to answer everything. So right from the glutathione supplements to biotin to whatever they want to take, how to use the hair conditioners, when to use conditioners, how to keep their hair good, how to keep them glowing. So these kind of questions, I mean, as the patients, like financial status also, economy also goes up. So they tend to ask these kind of questions as well. They expect us to answer these as well. So this is one field where you know about everything. I mean, technically, at least something about everything. Even though we are not jack of all trades, but something you will be knowing about everything, which is a big plus. And for that, they have to sit with us.
So there's a
Zainab,
question on YouTube.
we will ask something from Zainab. You've been from a college which is All India Institute, and then that's a place where Dharma and radio is taken after medicine. Why this type of craze is seen in only AIMS and nowhere else? We see in all India is radio, radio, radio. You might be the only one to take radio on rank one. Majority of the time we see medicine being picked up. That shows, one of the best colleges in the country, which has been labeled as number one almost for maybe 100 years now. But your take on why medicine is taken as number one branch?
I think it's more or less to do with, the passion that students have up front. When we are preparing radiology and dermat, both are branches which I feel are not passion branches. They are more informed choices that students tend to take for a more favorable work-life balance. Radiology more for students, who are much into reading, diagnostic algorithm and don't want to spend a lot of time in the wards. So I think if those are not contraindications, you end up leaning towards medicine. So that is also something I wanted to ask, sir, is what, in your opinion, are things that students, what are the contraindications before taking up medicine? Like, who should not take medicine? We have said a lot about who should take. What do you think are things that, contraindicate this branch?
People who wanted to earn a lot.
Really?
You don't?
Well, sir,
I-
in fact, that is going to be a good point, which should be, I sincerely feel, which should be raised by everybody over here, because the people that you see on your screen are in a way outliers. They are beyond two standard deviation, if Dr. Vivek Jain allows me that.
Yes,
Sir,
sir,
I
you're
would-
absolutely
I would
true.
say in most of the cities, the physicians with their setups earn the most.
Yeah.
And they don't
Obviously,
like
I
to
thought the same.
I don't really agree with that. I mean, I've been seeing people and they have to struggle a lot, sir.
Yeah, I mean,
It's
see,
not-
so after some lag period, once your practice has been established and you open your own center, then I believe the earning is no longer a problem. And this is more true for cities beyond tier 1 cities. Tier 1 cities, of course, it's a different thing. But tier 2, tier 3 cities, if you want to see people who make a lot of money, they are physicians and surgeons only.
True, sir, but physician's time is always a
Ah.
kind of limiting factor. In the sense, you cannot see 100 or 150 patients a day. I mean, if you are a MBBS GP, then you might be able to do that. Some people are doing that, but if you're an MD physician, you want to see the case properly. And in that case, you will not be able to see more than 30 to 35 patients. I mean, if you want to justify your field, then 30 to 35 will be the ideal number. And after that, they won't be able to see. And you cannot increase the fees as well. If you're going to tier 2 and tier 3, your fees also comes down, obviously. Maybe in tier 1, your fees might be higher, but in tier 2, tier 3, your fees will definitely not be more than 200 or 300 bucks, if I'm not wrong. You cannot charge more than that. So you will reach a saturation point. And definitely, if you compare with a surgeon who is successful like you in the same plate, definitely they'll be earning more. There's no doubt about that. Definitely, the money they are going to earn is going to be 3x more easily.
And
mean,
when people are
if
talking
you-
about money, Goga Bhai and Vivek sir are smiling quietly. They are smiling quietly there, but kar lo baat, keep on talking. Keep on talking. It's okay.
Sir, I have a question from Dr. Dilip. Dr. Dilip, still in the rural semi-urban areas, a lot of patient care is being taken care by MBBS. So at least in tier 2, 3, 4 cities and these rural semi-urban areas, how can we motivate MD medicine guys to go back to their roots and deliver to the population from where they came from?
Be the Ministry of Health, sir, 100%.
So how we can do that?
That's what I feel, because like your question is too good. Yeah, definitely. I believe that MDs should be there instead of MBBS people. But again, they should be paid well for the degrees. If they are able to pay them well, then definitely that's a good opportunity. But right now they are getting meager amounts, sir. When you go to, I mean, in the sense, if they're going to the private colleges, then there are some colleges that pay them very well. As I said, as you keep moving from the tier 1 cities more and more away, if you go to institutions, they're going to pay you well. Even there are institutions that are okay to pay even 3x, 4x. In that, there are some institutions which offer 50% as cash and 50% as white and all those kind of things also we do see. We get a lot of messages like that. So the money is not a problem. But again, there should be a balance between the money and the satisfaction part. So you might be ending up in a place, if you wanted money, you might be ending up in a place where there is absolutely no caseload.
So not only cases, their infrastructure is also a problem.
Exactly, sir. True, sir. 100%. You will not be having anything inside. You will be just going, sitting, wasting your time, talking to people and come back, but you will still learn. There are places like that. So that's why it's a kind of a tough thing to say. Like, I mean, maybe if they wanted to go to the tier 3, tier 2 places, and if the government is going to aid them, and if they want to replace those MBBS graduates with maybe MD people, then it will be much better, provided they are paid well.
Fantastic. So, sir, before we go ahead, let's talk about conceptual. Long back in 2017-18, I was talking about when we were taking session on gynae house yesterday. 2017-18, I requested my teachers, let's start something for postgraduates of orthopedics. Initially, nobody agreed, but it took me around 2-3 years to plead them. And now Praveen is smiling because he understands that he has to talk to senior people and what it takes. And so is Zainab. And then finally, in 2019 and in 20 beginning, we came out with conceptual orthopedics. The tagline was, the aim is not to live forever. The aim is to create something that can. But that was not enough. So I follow cricket. So there was a very beautiful line by Harsha Bhogle I used to love, that for the straight drive of Sachin Tendulkar, he used to write that with a touch of class and a stamp of authority. Right. So I wrote to him a mail, just wrote to him a mail that, sir, can I use this for my website on Conceptual, which I'm building? Within 1 minute, I got a confirmation, of course. And I actually checked, was it him? So I went to his place, and that is what. So this is what we did. We did it for 2-3 years, 4 years. We did different branches. But then came two youngsters. I might agree here, Zainab and then Praveen, who launched their branches of Conceptual. And both are doing so beautiful. And on this occasion of Teachers' Day, let us all congratulate Dilip sir that you are also launching conceptual medicine on the same stream. And here the responsibility is different. The question was, like we just were discussing in MD or DNB, right? Are the students studying or not? Now the question is, we are there to teach. Come and study. We are
True.
building a team. I was talking to Praveen some days back, and he requested one of the most senior psychiatrists to come and teach on conceptual psychiatry. It took him, I am very sure, to get senior people. It is a very big task. Now comes the big question. Vivek sir, Gobind sir, and Sparsh bhai are there on the screen. I want to thank them for their contribution. Goga bhai has been there from the beginning when I started making with my dad. He used to be there at the clinic and see the inception. And he always used to say this idea can click, right? And Sparsh has also been very positive. And I requested Vivek sir, can we have biostats lecture? And if you will know, what he said. I said, sir, how can I get, sir? कहता 100% आप करो, sir, मैं आपको lecture देता हूँ. And Zainab and Praveen, we all know that sir has given these lectures to us, and we are really thankful to them for supporting us here, right? So there are two different models. Zainab is making a model where she's taking at building up live. Praveen is building up a model which he's building up with recorded lectures. They both are very, very extremely different, in teaching and speaking, and with one of the most huge followings that they have. So before Dilip sir, we ask you how you plan for conceptual medicine. Let us listen to Zainab and then Praveen, how they are building their platforms, because they too have great following for residents also. If you look at MBBS students, that's true, but the residents also are following. So before they go ahead, Vivek sir and Goga bhai and Sparsh sir, thank you once again. We don't want you to leave, but I am just saying thank you once again from all of us. You have been there, you have been backbone for us on which we actually rely. The entire team of Conceptual looks for guidance from you. Right? Thank you very much.
Thank you,
Sir,
Dr.
thank
Apurv,
you for
and
your kind words, sir.
congratulations, Dr. Dilip, and best wishes.
Congratulations, Dr. Dilip.
Thank you,
Many
sir.
congratulations, sir. I sincerely feel and hope that the residents are also going to be having an equally good time as much as the undergraduates are having it as and when they're preparing for the entrance.
First of all, sir, I mean, I don't think anyone can get this kind of opportunity like what God has given me, because all of you are my teachers. I mean, sorry, Zainab ma'am. So everyone.
Praveen bhi hai kya?
I mean, sorry,
Thank
Prince,
God.
sir, also. Like
Thank God.
everyone of us are my teachers. Like, I mean, I'm not listened to other people, but I've listened only to Apurv sir, like way back in 2011. And whatever he has said during those days has made a lot of impact in my life as well. And that is the reason, whether other students are listening to his Monday motivation or not, I listen to it.
Oh God.
Because with every single session, like there will be something to take away in our life. So we all go for actors, and we see them, we take them as inspiration. People say that, but it's not about those people. There are people who can change our life. with their words or with the way they live. Like what I found out is there are each and every people in this particular screen are very unique in the way they teach something every time. So I've learned a lot of things from Praveen sir, a lot of things from Vivek sir separately, a lot of things from Goga sir, of course.
Hmm.
And
We also remember it, sir.
yes, sir, that's so that's why I mean that's why right now the reason for conceptual medicine is like I've been inspired from so many people doing for so long, and we really wanted to do it despite the task is going to be very hard and it's going to be very tasking, but still we wanted to take up the challenge. And the main reason, the main idea behind this is we wanted students to read, to get the motivation, and they want to go to the wards and they want to see the cases. So that is the primary goal. So the way we are going to teach, it will make them go back to the wards, see the case, and it's going to make a difference in the community.
Zainab, to you about how you built conceptual radiology, and then Praveen to you. We like to listen to that.
So, for conceptual radiology, the whole idea was, to make learning accessible to everybody. We see in radiology, there's a lot of discrepancy as far as the academics are concerned, depending on the kind of hospital you are at. So, we wanted to make it a level playing ground for everybody. So, the idea how we've built it is, we won't make it overwhelming for you. You see one lecture every day, you cover one topic every day. So we have started with the most important topics that a resident should know, and we have taken from that. So we started on 1st of Jan this year, and we are into September. So over 9 months, what we have done is we have built the curriculum in order of importance. So a resident always has the most important cases that they need to know about, the most important theory questions that they need to know about, on literally on their palms. So basically, the idea is to make learning accessible, to make academics accessible, and to understand the pain points mainly. We've been through a lot of years of training ourselves, and we know what are the pain points. We know how much time they get on a day-to-day basis for their academics, which is really not a lot. So they have hardly 1 hour to themselves, and if you tell them to study in that hour, they would not want to do that, right? So we want to make it easy, that this is a lecture, give it a passive watch, and you have that confidence that daily you are covering something important. So that was the guideline we had given to the students, that daily come for a live lecture, finish one topic, read up on that, and you keep covering your syllabus as you go along. So it helps all the residents, it helps young trainees who have absolutely no idea about radiology or about the field, and it also helps exam going. So it's a mix. What we try and target are exam going students with separate sessions on case discussions, spotter sessions, and then we have basic teaching sessions for young residents. So that makes it very interesting for us also as teachers. We have these case discussions with voluntary with volunteers. We'll have residents who are exam goings will come up, have mock cases, mock exams. So it is kind of a win-win. I have learned a lot over the last 9 months, more than what I have learned in my residency. The students have taught me, and through covering every topic in detail, even we are learning. So that way it's been very, very interesting. So I'm sure you are gonna have a lot of fun. Medicine has a lot of ground to be covered, and as you said, MD resident needs to literally know about everything. So it will be very interesting as to how you go on building it, and there is no end to learning. So in the end, it becomes like a very good resource as to when a student, let's say now if they join conceptual, they find that already all the topics that they need are there in the app. So becomes very interesting. Over
Praveen.
to you, Praveen, sir.
Yeah, right. So I think Dr. Zainab, you have already covered most of the things. I think whether it is conceptual ortho, radio, psychiatry, all of them are following kind of the same template. The idea is that there is a continuity. I mean, students who are preparing for NEET PG or INICT are learning from us. They know us. They know our teaching style, and if we can provide that continuity in the residency as well, that really helps. So that has been the idea with conceptual psychiatry as well. And what Zainab said is very right, that providing the level playing field. Everybody, whether you go to one of the bigger colleges or smaller colleges, because see, one exam mm, should not decide the level of training that you get. I mean, we were just discussing the last grand test of cerebellum. and we were just comparing the ranks of that grand test with the ranks that students actually got in the NEET PG exam. So some students who, I mean, there were students who were in the top three. One got rank 1, Vaibhav. Another got rank 1400, right? So those 3.5 hours may create a lot of difference. So we have to ensure, and these are toppers. They are still going to, all of them are going to good colleges. But then there are students who would probably go to some peripheral college, and they are in no way lesser than anybody else. So there should be opportunity for them also to learn from the topmost faculties. And with conceptual, the good thing is we can go beyond the whole idea of helping them crack an MCQ based exam, teaching actual skills that are required. I mean, I think at the level of it is more satisfying to teach somebody how to become a better clinician. Of course, teaching a student to crack the exam is good; it's nice. But satisfaction wise, I believe that when you teach somebody to treat a patient properly, that brings a lot more satisfaction. So that has been the idea. And as a sir said, building a team is difficult. Getting people who are, I mean, the who's who in the field, it's quite tough. But when they come and when they deliver a lecture and you see, and you are yourself in awe of those people, that how good they are, and ensuring that everybody gets to learn from them, that's I think a big thing. So, Apurv sir, this has been the idea, I think, for all the conceptuals.
What you just said, Praveen, exactly. नाम किसी कारण से ही होता है. There is a reason that people have a name. They
Right.
deliver. And academicians are so different from practitioners.
Right.
Learn during conceptual.
Right.
And that's the tagline that we always thought of. The learning never ends. This is how it goes. So I think Vivek sir and Sparsh sir, if you want to wish something to Dilip sir, and then he can give the concluding remarks.
Okay, Dilip sir, we know the kind of quality you are going to bring to this program. I'm just thinking how you are going to take it many notches higher, because you are already at a very high, you have set a very high bar. I wish you all the best, do great, and I'm sure the collective experience of the conceptual team is going to make medicine rock.
Definitely. Thank you very much, sir. And I'll be needing you, sir. We as a conceptual
You all
medicine.
need him always. And
Sir,
he's
we'll
always
always have.
yes man for us.
Like
Whatever-
all of us, you will also make a call to him and you will say, sir, can I also put the lectures in my app?
Sir, there is no need of
All-
even asking that, sir. There is no need to even ask about that, sir.
Obviously, we'll be needing Praveen, sir. We'll be needing everyone because there is a lot of scope in about psychiatry in medicine as well.
Yes,
Yeah.
sir. And in return, you have to stop writing Nexito Plus to everybody.
What answer? Actually, exactly. So that's what we
Just joking, sir. Yeah.
simply, sir. Simply.
Yeah.
So
Sparsh,
I
sir.
think Sparsh.
Sir, I think the word conceptual itself is pretty much symbolic of what it stands for. So I do believe that people who have got the opportunity to be taught by the better faculties at their respective colleges would be following them, and the people who have missed out on that for some reason, would be finding this particular platform as a very useful tool for their learning, and to be at par with the people, in terms of learning, that they should be having the equal opportunity to become better physicians of tomorrow. And I'm sure with the guidance provided by Dilip sir, and with the experience of people like Zainab ma'am and Dr. Apurv and Dr. Praveen, they are going to be having a wonderful time learning from the stalwarts of medicine. So best wishes for this wonderful project, sir.
thank you, sir.
Thank you.
And
So when are we launching conceptual medicine? I mean, when can students join it?
That's what he'll tell us.
Acha, yeah, please.
yeah, so we'll be launching conceptual medicine on September 16th, and the pre-booking for the same will be starting on September 7th.
So everybody says yes, yes, yes. All of you should subscribe.
Yeah.
Best wishes to all of you. And Dilip sir, we wish you all the best. And you are in a branch, right, which everybody looks up to. And I
Thank you
always
so much,
thought
sir.
that I can be a physician, if not an orthopedician. But anyways, you became a rheumatologist.
Actually, the other way around, I wanted to become a surgeon or an orthopedician when I was doing my entrance exam.
Apurv sir, you said you wanted to be a psychiatrist.
That was my
Change the
choice.
line with every-
You won't believe, Praveen, I took that in PGI. I took psychiatry in PGI. That is
I know.
well, because this is one branch, but तेरे को देख के लगता है नहीं बन सकता था मैं. You are the right person for it.
Chalo, बढ़िया, sir.
Anyways, the way to go forward, sir, we'll be doing live lectures. The reason why we chose live lectures is because medicine as such, we need to explain to the students. Many times the doubts that they're going to have will not be answered by the recorded lectures many times. So that's why we wanted to answer everything live. to begin with. So students can interact with us anytime. So because it's going to be live, and they can ask their questions about the patients that they have seen, the similar kind of cases, what they have seen, they can ask us anytime. So that's the main reason that we're going with live sessions. And this is going to make them see more cases in the wards. And it's again, like Zainab ma'am said, it's a win-win situation. For me as well, I'm going to learn a lot, and they are going to learn a lot as well, because we are going to put all of our experience into the conceptual medicine, and they can learn everything in one place. And I don't think, I mean, like you always say, sir, it's all about the worth that you bring. So that's what matters. Like we wanted to make it worth. And this is something where we are going to tell our experience to you, like no other textbook can give you.
Yeah, I agree.
Hmm.
Thank you very much, sir, and all the best to you. And thank you everybody for joining. Bye. Good night. Thank you very much. Bye.
And sir, such a wonderful news on the eve of Teachers' Day. Happy Teachers' Day to everyone.
Happy Teachers Day.
Thank you so much, sir. Best wishes to you also.
Thank you very much. Bye. Bye.
Take care,
Thank
sir.
you.
Bye-bye. All
Thank
the
you.
best.
Thank you, sir. Thank you, sir.